on the Positive Culture Framework's 3 critical skills, or 3 crucial skills that we believe prevention folks can improve to make their work more effective. My name is Katie Dively, and I work at the Center for Health and Safety Culture. I'm a research scientist, and in that role, I provide training as well as guide service. And that means that after folks leave training, you've probably all felt this before, where you go home and you sort of start to feel like, oh, I learned a lot of great information, but I'm not exactly sure how to apply that once I get home. And work is busy and life is busy, and it seems to take a second seat. So we've developed a guide service which allows us to sort of walk with you through this process of the Positive Culture Framework. So I'm happy to be here today with all of you to discuss these 3 really important skills. To tell you just a little bit about who we are at the center, we are an interdisciplinary center, meaning we come from a whole variety of different backgrounds to serve communities and organizations through the research that we do in participation or in partnership with communities and organizations, and training and guidance to cultivate healthy and safe cultures. And if there's any information that you wish to learn about our center, about the framework, to listen to other webinars, you're welcome to go to our website, and I put that on the slide here. We work with a lot of different groups, a lot of different community groups, organizations, statewide agencies, on a variety of different projects. The map that you see in front of you is a map of those projects that we've engaged in the past. Some of them are current, some of them are previous projects. But you can go to our website and you can actually click on any of these bubbles, and they'll tell you a little bit about what that project was, what years we did it, and so forth. So you're welcome to go and look at your state or people around you and what they've been doing. Today, what I'd like to do is just to provide a context for you. I'm not going to spend a lot of time on the Positive Culture Framework, but I think it provides us a good context of what these skills, how these skills sort of integrate into that framework. And then I will go through each of the skills, and that's prevention, leadership, communication, and integrating effective strategies or evidence-based strategies. And then we'll have time for questions and comments. So that larger context that I wanted to provide is by starting out with our framework. And I think it's important to identify what a framework is. We often get some confusion around this, and so I just want to illustrate that point, that a framework is different than a program or a strategy. What it is it's a way of organizing your prevention work. It's a way of organizing your prevention strategies. It often has a generalized process with it, sort of how to engage in that framework. Ours does, and I'll cover that quickly in a minute. We have critical skills aligned with our framework that enhances the outcomes. And also the quality of implementation, sort of how you go through that generalized process, is really important, and it does impact your effectiveness in your strategies and in your programs. Now, that is different than a particular strategy or program because these are specific actions that address a specific behavior. So, for instance, it might be a curriculum relating to underage drinking or substance abuse prevention, where that's very specific. It might be a specific policy, like a primary seatbelt law. And following that protocol with fidelity is incredibly important to the success of the program or the strategy, right? So we want to adhere directly to that work plan or that scope of work that we've been provided for that strategy to ensure that we're as effective as the folks that generated that program are. So just a little bit of a distinction between the two, and again, we see a framework as much larger and a way of organizing our work to improve health and safety. So this is a positive culture framework that we work from at the center. It is aimed at improving health and safety, which you can see on the far right. I mentioned, you probably heard me say, that this is about improving health and safety, and that's a core assumption of our work, that the positive exists and that it's worth growing, that we're looking at what's working right, we're looking at what those key attitudes and beliefs are that we want to grow and looking to improve those over time. We'd like to begin with the end in mind, meaning that we are thinking about this sort of going from the back end. So you'll notice again that this is an appreciative approach. You can see that with the upward arrow. It's coming back to our core assumption. And the reason, again, for the focus, that intentional focus and appreciative model is about improving something, improving health and safety, improving those behaviors, those attitudes that we know are so important. So with any good framework, there is a process. So how do we complete this framework, or how do we engage in this framework in order to be successful? So now that project, this process really helps us understand what we want to do. I'm going to go over it with a very high level, and then I'll come back to it a little bit throughout the webinar. But we start with step one. As you can see, I'm going to go around the outside edges, that blue process that you see in front of you. We always start our work with a good plan, right? So we're taking time, taking quite a bit of time actually, to plan what we're doing, to grow a coalition, to grow our partnerships, to build capacity among our partners, and to advocate. Perhaps we need to advocate for prevention. Perhaps we need to make people aware that this is that what we're working on is a serious issue in our communities. But we need to sort of start to plan, grow our partners, grow their capacity to be able to address these issues right alongside us. And then as we move into step two, this is a time where we need to assess the culture. What is currently going on here? Do we know, or what is what we know based on our assumptions of what's going on? So we really want to take a good amount of time and really better understand and assess our culture. In step three, we really look to make meaning of that. So what's sort of coming to the top? What do we want to sort of align around as our top priority? We move into step four, which is the development of a portfolio of strategies. I think all of us know that there's not one strategy that's going to eliminate the issue that we're working on or successfully improve health and safety in its entirety, but it's a portfolio of diverse strategies in order to be effective and in order to sustain our effectiveness long term. We move into pilot testing and refining. That means that we're starting with maybe a smaller subset of our population. We're looking to see how are those strategies implemented? Do we need refinement? Do we need to sort of back up and rework those work plans or rebuild capacity among those that are implementing the program or strategy, and then maybe refine that, recreate it, redo it before we go into the implementation phase? The implementation phase is just that. We seek to kind of set forth our programs and our strategies with maybe a greater audience, but really with that focused audience that you had in mind. We're paying attention at this phase. We're really listening to our audience. We're listening to those that are implementing the strategies so that we, if we need to tweak anything or guide the conversation around that, we certainly have the opportunity to do so. Step 7 is all about evaluating your effectiveness and also needs as you continue through this process. So we don't wait, of course, until step 7 to start evaluating. We actually do it at every phase of this process, at every step of the plan, and we have specific kind of guidance on how to do that at each of these phases. But again, it is a circular process, meaning that once we've implemented those strategies and really taken the time to reflect and understand and evaluate those, that we're actually entering this process again, because you might see that it might be time to replan things or grow additional support for our work and reassess the culture. So you can see that this is a circular plan. The context is also really important. So where do we do this work? We know, so we're looking at the middle of this circular model here. We know that individuals are influenced by social environments around them. We don't operate, our audience doesn't operate in isolation. Individuals are influenced by their family and their peers. They're influenced by the organizations they belong to. So if we're working with youth, that could be schools. If we're working with adults, that could be their workplace. They're also greatly influenced by the community, right, by the community's norms, perhaps by the policies in place in that community or the laws, and also how those are enforced. That definitely plays a role on what they believe and how they behave. So it's important to start to look at how these different layers of social influence impact our individual so that we can start to better understand, do we need strategies across this social environment, which we call the social ecology, in order to be effective. We're going to go a little bit more into that a bit later, but I wanted to at least provide that context of why that's within the framework. It's really about better understanding what social environments are impacting this individual and what do we want to do to take those into consideration when we're planning our programs and strategies. And lastly is the skills, and that's really what we're focusing in on today. That you see those three green words on the screen: leadership, communication, and the integration of prevention strategies. These, again, are those three key skills that help us reach our goal of improving health and safety, what's in our green arrow. We want our programs to be effective, right? Like, we don't just want to be busy implementing over and over again and not really sure or know that we're not effective. It's important to continue to ask ourselves this very important question: are we busy? Are we effective? Do we even know? Have we put things in place to even measure whether or not we are effective? These three skills I'm about to talk about today really do help us be more effective in our work. I love this quote by Otto Scharmer. He says that the leader's interior work deals with meeting and mastering three enemies. And that's really about quieting the voices that we all have in our heads at one time or another, the voices of judgment, cynicism, and fear. So if we think about this, we've had this from time to time, right? That voice of judgment, but that's a ridiculous idea that person proposed. We're judging that idea. That cynicism, where somebody's telling you maybe about a strategy that they are doing in their community, and you're saying, yeah, but that will never work in my community or within my organization, right? And then also that voice of fear, thinking, you know what, I could never get in front of my legislators or even my coalition for fear that I'll be laughed at, or for fear that they won't understand what I'm saying. We all have these voices at some time or other in our heads, and the first step is, I think, really to be aware that these voices exist and what their role is in influencing and interfering with our efforts. You know, it's an important question to, I think, ask us is, how do these voices keep us from moving forward, from questioning what if? You know, what if that program actually works? What's the hurt in just thinking about it a little bit more? If I didn't immediately judge this idea, what could I learn? What if I didn't have that fear? So as we move into the first skill, the skill of leadership, we know that prevention, what all of you are doing, is an act of leadership. All of you are leaders on this call because you are leading people, either within your organizations or within your communities or your families, towards healthier and safer actions. There are three aspects of leadership that I want to cover today. You'll see them on the slide in front of you, and we'll go through each of them by themselves. So we have the first one, which is raise hope and concern. The next one is that ability to think across that social ecology, or those layers of social influence in our community that I described earlier. And then third, that ability to cultivate transformation. What does that look like? How do we do that? So starting off with raising concern and hope, this is critical, and doing both is critical, meaning raising concern and raising hope. We need to raise the concern if it's not there. If our community isn't concerned about the issue that we know is impacting health and safety, we need to raise that level of concern so people know that there's a problem. This can also help in making people want to participate or think more about the issue, make them more aware. So this is all very important at the beginning especially. But alongside that, providing hope is also really important. It's critical. We need to provide hope so that people understand that there's something that we can do about it, right? We don't want to leave this, this community or this group feeling hopeless, that there's nothing to do, that, being unhealthy is inevitable. That's not it. We want people to know that you've got a group of people committed to working together. That's a sense of hope. That you've got evidence-based strategies available. That's definitely a way to provide hope. And that we have a path forward, that we're creating a plan to address this issue. So those are definitely ways to start to build hope. So raising concern and hope. And I also think it sort of begs the question about what is the difference between concern and fear. And I do want to make that clear because I think there is a difference. When we ask folks in trainings, people often say that the sense of fear is associated with the feeling of trying to get away, the feeling of trying to escape, not having time to think, but just getting out of the situation as an automatic response to something negative, something scary, right? That's what sort of is elicited within us when we think of fear. Now, this is different, than concern, where people sort of identify concern as having more of a feeling attached to it, a feeling maybe about caring about the issue or caring about the person, maybe enough to act or get involved or want to learn more. It can motivate more thinking about the situation, which is definitely what we all want. We want people to be thinking about the actions that they're about to engage in, right? We don't want them to just do them out of reflex. We want them to be thinking and choosing what they believe and how they behave. We also know from years and years of research that fear appeals can have unintended outcomes, that we didn't expect or definitely didn't want going into that program or strategy. So the research will tell us that that fear appeals can label and stigmatize, right? That sort of the users versus the non-users, definitely places that we do not want to go in our community. We want to build a community. We want to support individuals as much as we can. We do not want to transfer stigma to anybody. They expand social gaps. Again, definitely what we don't want to do. We want to bring people together, work on this as a community. And lastly, promoting poor health as a value. We want to promote the healthy values that exist in our community and really work to start there. And I would say lastly, something else that isn't listed here but is definitely found in the research is that fear appeals are hard to sustain, right? So they do have this ability to create a sense of shock or urgency in the issue, but that's often short-lived and is worn off maybe hours or even days later. So we want our work to be effective. We want it to last. And so fear appeals can sort of contradict that notion. This is different, again, than building concern. When we move into hope a little bit more, again, talking about both of these feelings, hope is not this fluffy, happy, happy-go-lucky, don't worry, be happy kind of notion. It's an actual measurable construct. It is the perceived capability to drive pathways to desired goals and motivate oneself to use those pathways. And we really see this broken down into two different things. It's the willingness to move forward, the will, and seeing that path forward, which is the way. I think when we have hope, this means that we're sort of in that place to move forward, right? We have that motivation to do something. And I think as prevention professionals and leaders in this work, I think it's our opportunity to provide that path forward, right? We often have that path forward, whether it's coalition building, whether it's implementing a strategy or just sitting together and thinking about this. That provides us some path forward. And I think if you flip that around, if we don't have that path forward and if we don't have that will, we don't act. And that's important. We want people to engage. So that is raising concern and hope. Next, I want to talk about the second leadership skill, which is thinking across that social ecology. So again, here is what you saw in the middle of our framework. We don't operate in isolation, which is what I mentioned earlier. We're influenced by those social environments around us. One thing that I wanted to mention that I didn't mention earlier, I said earlier that individuals are impacted by their family and their peers, right, by their family's actions, by their family's beliefs. They're also impacted by the schools and the workplaces that they belong to and that the community at large. What I wanted to say is that it also works in reverse, where the individual can make an impact on their family and their peers, on the systems that are in place in their community like the schools and the work sites, as well as the community at large, public policy, enforcement of policies. So it does work both ways, and I didn't want to miss out on saying that before. Moving to a place where we can start to consider like as a prevention person, moving to a place where we can start to consider the social ecology in our work is transformational. This is a whole new way of thinking. So what this might look like, perhaps if we're working on underage drinking, it's transforming our approach, where before we might have said, okay, how do I get youth not to drink? But now, considering the social ecology and keeping that in our minds, it's what actions do I want to grow across that social ecology to reduce underage drinking? So if you can imagine, going back a slide here, if families have a great influence on individuals, if an individual is learning something in school and we're only putting our resources towards this individual, but we don't do anything with their families, how likely is it that an individual that learns something maybe about the risks of alcohol in health class, that they're going to keep that in mind if it's not repeated perhaps by their family or reinforced with their family, or if they see perhaps the school not enforcing policy relating to alcohol violations, or even the community not enforcing those laws. So you can see if we don't have these other pieces in place, these other strategies within these systems in place, it can really prevent that reinforcement value that we know can be so beneficial. So again, it's about what actions do I want to grow across that social ecology? What do we want to do with parents? What do we want to do with schools? What do we want to do with law enforcement? What policy can we pass to help sort of embrace this idea of underage drinking? An example of this can be seen in this chart. So examples of things that we might do with individuals is often education, right? We can educate them about the risks associated with use, the consequences associated, right? Teaching them refusal skills is always important. Families can do something too. They can have family rules about not using alcohol. They can implement a curfew. They can, do things to lock up alcohol, make it less accessible, make it less available. Schools and work sites play a role too. Schools can have policies like an activities participation policy where if somebody's in violation of an alcohol law, they might have to sit the bench for the next 5 games, something like that. And work sites also can have policies, even though their employees might be 21 or over. They might still look at how alcohol is used within the work site at parties or something like that and seek to restrict some of that or just put some guidelines around that. And at a community level strategies, things that people can be thinking about to help reinforce the reduction in underage drinking is policy, really. So we've heard of social host laws, trying to eliminate people providing alcohol to youth. You can also think about special permit policies for festivals. Do we have, alcohol being sold at places where youth might already be, like our county fair or like a church picnic, things like that. But also consistent enforcement of those policies. If the youth understand that they probably won't get caught or the consistency isn't there for law enforcement, they're more likely to engage in that behavior. So we really want to look at these strategies from this lens as kind of reaching each layer of the social ecology so that we're more effective, but also so that this work is sustained long term. This is really what we see as a cultural approach. The third leadership skill that I want to talk about is cultivating transformation. So we're familiar, people have all seen this slide probably, that we're familiar with the idea of a caterpillar transforming into a butterfly. And when it's complete, the caterpillar is fundamentally a different being, right? It's got a new shape, it's got new actions. It can't go back to being a caterpillar. It is truly transformed. It's a butterfly now. So that's transformation. That's different than change. Change is much simpler. A caterpillar can change. It can change its size. It can change how it eats. It can change location. Where transformation, like I said, is fundamentally different. It's one directional, right? That butterfly can never go back to being a caterpillar. It's much deeper. In human, we don't see sort of this physical change like a caterpillar does, turning into a butterfly. It's internal for us. It's shifting how we think. It's shifting how we operate. It becomes sort of part of who we are and what we know, what we believe to be true. Another thing I wanted to mention is that this doesn't happen overnight. This is not easy by any means. You see that cocoon-like phase in the middle here. It doesn't mean that the caterpillar just happened to, happily wake up one day and it was a butterfly. No, it's struggle. There are struggles involved, and I suspect that you have maybe sensed some of this in your work in transforming your community. It's stressful. It's challenging. We may experience some elements of this. It's hard to enter that phase of transformation, but it's important for us to acknowledge when we're in it that it's stressful. We're struggling through this phase, and it's kind of an opportunity to step back for a minute and see that big picture. You know, as a society, I think we can recognize transformation that's occurred. I think we can see that in tobacco prevention, right? So we've seen a huge transformation in tobacco prevention maybe since the 70s. We have Clean Indoor Air Acts. We have, all sorts of different policies that we would never repeal, right? We would never go back to that place. We're fundamentally different. Also, child safety restraints is a big one. We will never go back to putting our kids in the back of the station wagon without being seatbelted in, right? Like many of us grew up. We will never go back to that point. We know too much now. We value the lives of our children so much that we will never go back to that place. And I think on the horizon, and you probably are seeing this in your communities as well, is the transformation of how we address concussions, right? So I don't think we're ever going to go back to a place where we're not going to think it's important to address concussion prevention and care when individuals receive a concussion. It's just not going to be true that we're going to go back to that place. We know too much now. So again, unfortunately, we are not able to transform anybody but ourselves, right? It's internal. It's within us. If we could, transform other people, boy, our jobs would be a lot easier, but unfortunately we can't. One thing that we can do, however, is to cultivate an environment where transformation is more likely. So if I'm planting something in this garden, I can't make that plant grow. I cannot force that to happen, but what I can do is create conditions where it has that opportunity to thrive. I can provide enough sunlight, I can provide water and nutrients for it to grow, but I can't force that to grow. This is true with individuals, absolutely. We can, and within our communities, we can plant little seeds. We can ask really important questions that help people start to think about how they see the world, about how they always have done things, right? Planting those seeds, are we busy or are we effective, is a great transformational question. It gets people to think, oh, I've never thought about that before. Am I doing this because I've always done it, or am I doing it because it's effective? That's starting to transform how that individual thinks about their practices. So when we look at transformation, again, this skill in leadership relates to cultivating transformation. When we look at it sort of at the individual level, it's about changing our mental models, us as individuals. How do we think about the situation? What are our core assumptions about this issue? And that's a little bit different than the collective. The collective, which is changes across many systems. So this is like community level change where we have small changes sort of coming together on larger scale. Becomes more difficult here, but definitely where we seek to go. So that is the leadership skill. Next, I want to talk about communication. I bet I have yet to find a single prevention strategy that doesn't require some form of communication. However, we know that communication efforts by themselves are often ineffective. So it's really important that we have intentional communication that's grounded in good science before implementing any prevention strategies. This goes from our own personal communication, our voice, all the way up through mass media campaigns. Planning and being intentional about communication plays a role in how effective that strategy is. So there are so many ways that we communicate with our audiences, and it seems like, or many opportunities, I should say, to engage with our audience, to communicate to our audience, and probably a million different ways to do that, right? So there's a lot of words we can say, but there's also a lot of ways we can use those words, either having a conversation with them, creating a webinar, having an assembly, you name it. There's lots of ways that we can communicate to our audience. That being said, I think it is all the more important that we have great intention about our communication so that we achieve those goals that we set out from the front of improving health and safety. All righty. So as we look at communication skills in particular, again, we want to be very intentional so that we're designing our communication to fill a need or to close a gap, as we might say. It is busy work, it is not effective, to tell somebody something that they already know. This could be an example of telling an adult or even telling a child that smoking is harmful. They already know that. What does our data tell us that they don't know? Or what is the missing gap? Perhaps they need, family rules and reinforced, or perhaps we need a community policy that's enforced. But it is busy to tell somebody something that they already know. So we collect data to better understand what it is where we have some gaps so we can fill those gaps with our communication. Communication is also a tremendous opportunity to serve as a catalyst for other prevention strategies. I suspect that you've recognized this as you implement a prevention strategy in your community, or within a school, wherever it might be, but there's conversation that takes place, right? People are starting to question it. Why are we doing this? Well, what exactly are we doing? What is the problem here? What else are we doing? All of those conversations are great, and I think that we need to insert ourselves into positions to be hearing these conversations so that we can hear perhaps what else is needed, right? What other prevention strategies could be or should be taking place right alongside this communication effort. This is also an opportunity to tell a new story about our communities, right? We are in charge of that story that we want to tell. What is the story that we want to tell? What does our data say to help lend to that story? And then how do we actively start teaching health and safety as a part of our culture? How does this become part of our culture? So to be intentional about communication, we have a 7-step process for doing this. You'll see that it closely, it looks very similar to the 7-step process for the positive culture framework that I showed you earlier, but I'm going to go through this at a high level and kind of point out some of the differences. So to be intentional about our communication, again, process is key. We start with a planning phase, right? We always want to be very intentional about why we want to communicate. We want to plan around that. What is the purpose of this communication? Maybe start to make plans about, do I need others alongside me? Getting your stakeholders in line. Step 2 is about collecting the information, right? Collecting the data. I don't want to communicate without knowing what needs to be said. I don't want to be busy rather than effective. So we're collecting information. We're starting to realize, wow, where are those gaps in my community that we could perhaps communicate about? Again, that communication can be any prevention strategy. It can be a letter. It can be a curricula. It can be passing public policy. But we're collecting the data to know where those gaps are. In step 3, we're developing that message, right? Whatever we learn from the data becomes a message to close that gap, to fill that need. And because there are so many different ways of getting this information out there, we really want to we want to be thoughtful about it, right? We want to develop a communication plan that helps us release these messages in a way that's going to ensure that we're effective. How many times do we tell our children to clean up after themselves or to make their bed or to pick up their shoes by the back door? A lot of times, right? It doesn't just happen once and then they've miraculously figured out for the rest of their lives. And those are relatively simple behaviors. When we're talking about changing behaviors, these difficult behaviors like substance abuse, like violence prevention that we're working in, dosage of these messages are very important. We need that dosage to be high, and a communication plan helps us plan that out. Next, we want to go into a pilot testing phase, right? So we want to ensure that our messages are clear, that they're understood, that they are received with the intent in which we wish that they were received or that we're sending them. But this is a great opportunity for us to listen to the audience, hear what they're saying about the pieces, revise them if there's any clarification that needs to be made before we go into step 6, which is implementation. So again, this can be a campaign. This could be just about any type of communication. But this is where, again, we listen. Because if we implement any prevention strategy, there's going to be conversation, like I said. So it's important for us to put ourselves in the place of that conversation so that we can guide those conversations. And then in step 7, we evaluate. And, of course, we are evaluating all the way through. But this is really a good time for us to think and reflect and to check in for our process measures, our outcome measures, and all of those things so that we know, were we effective? Was our communication impactful? And what do we need to do different the next time we go around the 7-step model? So a couple of different ways that we've used the 7-step model, or communities that we've worked with have used the 7-step model, is through just simply having conversations, right? If you're about to have an important conversation and you really want to plan that out, we definitely encourage using the 7-step process. You start to plan. Then you need to collect some information. Why am I even having this meeting? What are the main points that I really want to say? And then actually creating those main points, right? And perhaps you want to pilot test that to see if somebody else receives it the same way that you hope your audience does. So a conversation can be used. Even a meeting, planning a good meeting, we can use these 7-step strategies. Writing a letter, we've definitely done this, whether it's like a letter to the editor or a letter to someone, and perhaps an elected official outlining what your message is could be very important. Writing a press release, like I said, holding a town hall or another public meeting, great opportunity to use the 7-step process. Again, we're communicating in each of these strategies, and we want intentional, thoughtful communication so that we are effective rather than just busy. So using the 7-step process can be incredibly helpful. And then ultimately up to probably the biggest type of communication, which is these mass media campaigns. We know from research that that communication can actually be quite ineffective, particularly mass media campaigns. So we want to be very sure that we're adhering to the science and we're following good research in order to make our communications successful. So research will say that when campaigns are coupled with other ongoing prevention activities and they have enough exposure, right, that dosage of that message over and over again, that's when they have when they're more likely to be effective. So we really want to think about that as we go into efforts, particularly to do a mass media campaign, that we're grounding that in good science and attaining adequate exposure, but always keeping in mind that we're doing that with a mix of other strategies. And that really brings me to the third skill, which is the integration of these strategies. So this is actually, I believe, one of the hardest skills to build and to master, but this is the time where we seek to make whole, where we seek to bring things together. We have this whole host of diverse strategies because we know behavior is very complex. There's no silver bullet. We sort of wish there were, but there isn't. So our work is to integrate and make this diverse group of strategies come together cohesively. And again, this is a pretty difficult skill and one that takes time and patience to really become good at. But boy, is it worthwhile. We can have a bigger effectiveness or bigger bang for our buck. So I think when we look at integration, before we start looking at the programs or the strategies that we want to engage in or that we want to align, it's important for us to look at ourselves. I think when we look at integration, like I said, important to start with ourselves and particularly with our coalition and maybe our partners at work. So do we have an effective culture? Do we come together cohesively around this issue? So I think something that's important to take a look at is yourselves, or sort of that key agent of change in your community, whether that's a coalition, whether that's an organization, but how do you interact with one another first before even going out to the community with strategies? So there is, I probably can't say this enough, but coalition building is worth every penny. Taking the time in the planning phase before you ever start creating messages or starting to think about strategies, do the work at building the capacity, the knowledge, the resources of those committed to this issue with you, because that will pay off greatly in the end. This is about the time where we're developing a common purpose. What are our shared values as a group? Because when you can align around that common purpose and come together around shared values, you really can work together and move forward more cohesively. This is about understanding common language. What are those consistent messages that we want to share? And understanding, building, having an opportunity where there's shared understanding, where maybe you go to a training together, where you're using common measures for how you're measuring success, for how you're measuring these issues. So really taking the time early on to make sure that you guys are integrated as a group is really important before you start figuring out, are our strategies integrated? So augmenting and refining programs and strategies is really important. This is where we have the ability then to make some decisions on if we need to bolster our effort with new strategies or perhaps get rid of some of the strategies that aren't producing some of the outcomes we're looking for. We've already detailed the fact that we need a mix of programs and strategies across that social ecology in order to be effective, right? There's no silver bullet. We need to have strategies at each level of this social environment so that our impacts with the individuals are supported, are reinforced, and sustained long term. So as we start to look at this mix of programs and strategies in front of us, we need to be proactive about managing this complexity, right? So therefore, to actively manage our prevention portfolio, we need to first figure out what exists in the portfolio, meaning we want to map our existing strategies. What is currently taking place in my community related to the issue that we're seeking to address? Our organization often helps other communities and organizations do this. We help them map out their portfolio so that they can make these really important decisions on what needs to be added or what needs to be removed from their prevention portfolio. Where do they need to make investments, right? More programs, more strategies. Where do they maybe need to take out some strategies that weren't working so well? We can't do that until we map our portfolio, however. And I think once that map is developed, I think these questions are incredibly important. So you're looking at your map, you're looking at that list of strategies that are in front of you, and you're asking yourselves, and as a coalition or as an organization, you're asking yourselves, do our prevention investments, meaning those programs and strategies that we're investing in, do they match our goals? You might assume that they are, but once you start to see them on paper, you realize, oh my goodness, we might be kind of all over the map in terms of what we're addressing, but we really haven't streamlined our effort, meaning, boy, we have something related to seatbelt use over there, something related to drinking and driving over there, something related to underage drinking over here, but we really don't all align around one goal, because that could help you kind of be less of a mile wide and an inch deep, but be more focused and intentional on fewer strategies perhaps. Do you have any gaps? Do you have any holes where there's a population that's not being addressed, or there's simply no strategies for, perhaps for individuals who need intervention? So this is an opportunity, too, for us to take a look. Where are there holes in this map, and how do we then start to figure out how these holes might be addressed? How can we produce or develop or invest in strategies to fill those holes? And ultimately, how well are we assessing our portfolio effectiveness? So once you start to look through this map and you start to pay attention to evidence-based strategies versus other strategies that you don't know if they have any evidence behind them, or you know that they don't have evidence behind them, you start to get a good picture of whether or not you're busy or you're effective. If you have more strategies on there that are that you have no idea of if they're effective or not, boy, I think that's a time to start to relook at your portfolio and what you're investing in, because maybe your investments aren't going to the right places. So now that we've mapped the portfolio, we've made some decisions, right? So we know maybe we need to add here, remove that, or even refine something to make it stronger. We also want to look at how these programs are working with one another. So are they competing with one another, meaning one strategy is saying one thing and another strategy is actually doing something entirely different? Are there opportunities to align or coordinate particular programs? Are there opportunities for bigger shifts, like system-level shifts, which we know would be great? So an example of that, I think this is a pretty good example of how that might happen, is maybe changes in policy. So if we're looking at, just as an example, if we're looking at underage drinking and we have youth that are arrested for underage drinking, if we have maybe a policy in our community that says any minor that's arrested for alcohol consumption has to participate in a diversion program, and that diversion program that they're specified to go to has a specific curriculum, an evidence-based curriculum that they follow, we can see how cool that alignment or that system alignment is. So we've got 3 individual strategies. We have the policy itself, right, that says that they're all going to go to this diversion program. Well, first of all, we have the policy for underage drinking, and then we have a policy that says everyone who goes, who gets this violation has to go to a diversion program. That's a second or a third strategy, and then ultimately that evidence-based or that strategy, that diversion program, has an evidence-based curriculum. We can see how we've just aligned 3 different prevention strategies there. So that can be pretty powerful when we start to leverage other prevention programs and strategies right with one another. So as you can see, I've done a high-level overview of our framework, but really paid particular attention today on those 3 critical skills that help us implement this framework with greater effectiveness. And I think prevention, folks, I think in any work that we do, we can all benefit from growing our leadership and the leadership of those around us, our communication skills, and seeking to be really intentional in using a process for communication. And then ultimately about integrating our strategies, our mix of strategies that we know we need, integrating those strategies together for greater impact. So if there are individuals that are listening today and if they are looking for more information on this framework, because I really only provided a very small overview of it, but if you're looking to learn a bit more, I wanted to notify everybody that there is a framework training coming up. So it's the Positive Culture Framework training happening this fall in Savannah, Georgia. We're very excited about it. Registration is coming soon, so you can be sure that you can join our mailing list. You can take a look at our website because we will be posting that registration page soon. It's going to be September 25th through the 27th in Savannah, Georgia. Another really exciting opportunity that we have coming up, a great opportunity to build capacity, is our first symposium. Now, this is not specific to our framework. This is really about improving health and safety and about how do we grow a positive safety culture in order to improve health and safety. So this is going over a wide variety of different topic areas that you are welcome to take a look at our website and look at those topic areas. So we're very excited about this. This will be in Bozeman in June. It'll be the 20th through the 22nd. Registration is open for this, so you are welcome to go to our website. You should see that right at the beginning of the page when you log in. So just 2 different capacity building opportunities coming to you from the Center for Health and Safety Culture. So now I want to open it up. Folks have been on mute all along, but I want to take the time to open it up and see if there are any questions. So you are welcome to unmute yourself if you'd like to ask a question. You can also type a question into the question and answer portion of the screen. So I'll leave it open now to anybody that wants to ask questions. Another thing that I wanted to mention is that if folks are interested in listening to this webinar again or any of our webinars, we do post them on our website after the webinar is finished. So this has been recorded, and you can definitely download that to listen to it again or share it with your colleagues if you feel that they might have interest in learning this information. But always know that you are welcome to go to our website and learn more. Also, if you have other interests in different webinars that we haven't done yet, please let us know. We're always taking suggestions of things that people want to learn more about, so we'd love to hear your ideas. So one question that came into the chat box is whether or not we can share some resources or research to guide mass media campaigns. So we definitely can, and if somebody, we absolutely have research on different campaigns. We can also help either provide training or guidance to create those communication campaigns as well. And I question of whether or not you would be interested in maybe sending a message to our website, because then I can interact with you individually and help answer some of those questions, because I'd be happy to share more on that. There's quite a bit of research out there on health campaigns. If you start to look at that, it usually says that if they're grounded in good science and they have a theoretical background to them, that they're much more likely to be successful. So that's definitely how we create our communication campaigns, that they're grounded in that good theoretical framework of behavior change. Any other questions that came in or that people have? One question that just came in is, can I suggest any existing resources to assist in completing an environmental scan of a campus relating to current health and safety efforts? Yeah, I think I can do that. I've got a couple in mind. There are definitely tools online for creating an environmental scan that I've seen. We can certainly talk a bit more about how we map current strategies, so I'd be happy to talk about that more to you. There are also some tools, they're a little bit different, but some tools in the community toolbox that might be helpful in creating that plan as well, or that environmental scan. It kind of depends on what you're looking to do as an outcome. So if you're looking at better understanding what those health and safety programs and strategies are and sort of where they fall maybe on the social ecology, and also according to what the Institutes of Medicine would consider the continuum of care, whether or not it's a universal program, a selective program, or an indicated program, that's how we map those strategies. But if you're looking at something a little bit different, I'd be happy to discuss that with you. If you wanted to send, again, a message into our website, I can certainly guide you to something more specific. One thing I want to mention on that, so you mentioned health and safety efforts across the departments. I've actually done that. I did that for a health department where I realized as I knew of these tools that we use at the center, and I realized through listening to different conversations that there were about 6 different departments that were all addressing alcohol in some way, shape, or form, but none of them consistent with one another. So the health educators were speaking about alcohol, of course, and prevention of substance use disorders. We had sanitation workers that approved health inspections for restaurants and bars that were also talking about alcohol use. We had a group doing responsible beverage server training. We had nurses that were going into homes talking to new mothers and even pregnant women. And so we realized that there were all these opportunities to start to align our messages, and the portfolio mapping process worked really well for that. Well, that is all of the questions that we have coming in. Again, if you are interested in hearing any more or chatting with me about any of this, you are welcome to send a question into our website, and I can receive those, and we can talk individually about that. But I appreciate your time being on the call today. Again, this is recorded, so you will see that posting on our website very shortly. Thanks all, and have a great day.